nada, muchas gracias por atendernos. Vamos a hacer el primer workshop a nivel de formadores para Hyacorp, trabajando con Medyglobal. Somos los distribuidores oficiales en España para este laboratorio y bueno, vamos a ir haciendo unos tratamientos a lo largo de la mañana que van a estar principalmente enfocados a nivel facial y a nivel corporal. Los faciales vamos a hacer por un lado ojeras, mentón y pómulos y luego vamos a utilizar el Hyacorp a nivel corporal donde vamos a hacer un tratamiento de manos y de glúteos. Espero que bueno, pues, a lo largo de la mañana se vayan cumpliendo y cubriendo todos los objetivos de los asistentes para que cuando ellos vean cómo se hacen las técnicas, cómo se hace el producto, podamos empezar a hacer las formaciones a nivel nacional con este médico. La verdad es que es un equipo bastante bueno y bueno, pues os dejo ya para que empecéis a ver cómo van a resultar todos los tratamientos y espero que disfrutéis. Así que nada, muchísimas gracias y disfrutar del evento.
A ver, leer el currículum de este señor podríamos estar todo el día, así que básicamente, bueno, le voy a presentar al señor doctor Hyacorp, es el presidente de nuestro comité médico, de hecho, o sea, la persona más experta y más idónea en lo que es a la hora de usar Hyacorp es él. Básicamente, bueno, es de Italia y tiene clínicas también tanto en Dubái como en Milano. Así que, mire, no voy a seguir más ni porque podría estar todo el día presentándolo. Así que lo que voy a hacer es darle ya la palabra al experto.
Thank you so much, and thank you so much for the introduction. Yeah, I have a good experience. I started since a long time to inject everything in my life from because at the time I started there was only silicone. Then I started when I went out to collagen, then other not resorbable fillers, calcium hydroxyapatite, and in the end of 90s started the hyaluronic acid. This is the history, and I saw everything in my experience: complication, good result, bad result, unsatisfactory result, people happy, people don't happy. So this is why I feel confident with the fillers. At the time I started, I'm a plastic surgeon. It was quite forbidden for plastic surgeon to do filler, because when I was young, to do filler is something that we're doing only low quality of doctors. Fortunately, it changed the mind, and actually the filler is one of the biggest production for aesthetic doctor, dermatologist, plastic surgeon are doing, each one with his own skill. So plastic surgeon will do in a certain way, aesthetic doctor in another, and dermatologist. But the result always is successful because the hyaluronic acid is a safe product, and in most of the cases it depends how is the production. I was telling before how is the residual part of cross-linkage, how this is cross-linked, and so on. Then Hyacorp dermal fillers, we have to talk that are biphasical, and sometimes I find a lot of doctors say, no, I use monophasical, I like monophasical. It's not about I like or I don't like. The result is always happens. But the way of using is different in monophasical and is different from biphasical. Hyacorp dermal fillers and high viscoelasticity. What does it mean? That even if they related, so they recover the original shape, so you have your filler inside, you insert, and you can really feel the wrinkle, or you can give the volume. At the same time, you have a very soft effect during the piston, and at the same time, it is easy to inject. At the beginning, when it comes inside, because it's biphasical, it starts spreading, and if you start massaging, if you start moving, and you start working on the side that you're injecting, you will have a nice result because it's high elasticity and high cohesivity. So the concentration and the degree of cross-linking make this product stay for a long time. When you think about Hyacorp and bioscience product in general, you have to think that you are using something that are giving a lot of volumetric results. It's important this because you have to use in the right way. Because sometimes if you're not used to use biphasical, I think the other biphasical is Restylane that never change. It always started at the beginning with a biphasical product, and actually still they have biphasical product. Is a very good product, but you have to use it in a different way from the monophasical. And we are talking about this. And biphasical is not, it doesn't mean that it's two phases. It's a way to call the quality of production. So it's a cross-linked particles in not cross-linked HA. Monophasical instead are several dimensions of particles that are all together and coming in gel. And what does it mean? Does that in your normal activity, what you have to do to have a good result is to do the first injection. Let's say first injection if you want to use on the lips, or if you want to use on the cheeks or something else. And then after 1 week or 10 days, sorry, but with the mask it's very difficult to talk, recall the patient and do a second retouch, because at the beginning you have a lot of recalling of the water. Then you have a deflation, so the patient is happy because you see a lot of volume. Then the deflation is come to normal, come like a monophasic, and the patient is used to see this big volume and say, I don't have volume. No, you have volume, but you want more because you've seen that you have to put again. And so does it mean that you have a very good result, and then you have a good response of the body and volumetrical one. Hyacorp is doing even for you that you're doing even revitalization of the skin, is using Fine. Fine is not cross-linked one, is specific for biostimulation, is 5 lines, superficial wrinkle, orbital line, revitalization, and décolleté. And this is immediately the result. It gives, you see some lumps, and then there's a final to another girl. You see how the wrinkles are completely treated. Then there is one specific one for the lips. Hello, good morning. And specific for the contour of the lips, and a high viscosity biphasical dermal filler. This one, as I told you, you cannot have to overfill, because the biphasical product that you don't have to overfill, because at the beginning if you overfill, the patient the day after will wake up with 2 lips and will call you or will send you WhatsApp, what happened to me, doctor? No, you have to fill, just giving a filler, like you see the good result is coming. Then the next to advise the second day, third day of the patient, he will have a big inflection, let's say it's more inflection, 30% more or less, then a deflection, and then you can do again if the patient wants after a few days. For sure, this is good even for lips contour. Maybe you have better cases than this one, but what I have to show you, this is the immediate result I had in a course recently. And so the patient, when goes out, is really happy because see the shape is coming. And this is after, let's say, the second retouch I did the patient, and still you see that still remaining the volume. And then this here I did the second retouch, very small dots, and with a good volumetrical result. And what more, that actually they are going is on fashion, let's say they're calling cherry lips, Russian lips. I don't know if you know something about Instagram. I'm not in Instagram. As you see, maybe you went to see me, but I'm not so social. But in any case, we have to face this problem. That we have someone who come, I want to Russian lips, then I went to see what is the Russian lips around. And this is very good because you have to inject, the lips are very good because you have to inject more deeper. You have to inject instead of injecting in a normal way, as you do before the contour, then the soft part, you have to inject from external part, injecting more deeper and giving more volume to all the four places, especially in the middle area, and you will have a big volumetrical response with the lips. Then the fill is the new one, and the fill is a very good product, especially for a periorbital area and superficial medium wrinkles and periorbital area. I use for the contour, sometimes the contour of the lip, and this is the result after using the fill. It's very important the way you are injecting, because someone is injecting with cannulas, someone is injecting with small needles, someone is injecting in different way. How I'm doing, because I'm here to share the experiences, as I told. I started before with the cannula injecting softly this area, but I've seen that maybe in some people you can have big lumps appearing after 1-2 days, and they can stay. Why? Because the eyelids area, I don't have a dashboard to show, but maybe you know much better, has a lot of lymphatic vessels. When you inject every hyaluronic acid, every product, calcium, we are talking everything you're injecting, the risk is to close these lymphatic vessels. If you inject too much, you will see that the patient will have the lump, so you have to use hyaluronidases to erase and to remove. And is a frustrating, this one. Then, how to achieve the best result, especially with the fill that is biphasical. I always remember you as a biphasical. You cannot have to inject as much. You inject with monophasica to make some dots very small, very tiny dots. I'm talking about unit. I used to put in an insulin syringe partially the product, and then inject in units, and then to massage. This what is doing, very superficial, what is doing is spreading the product, is not giving too much volume, and at the end of here and here, maybe I put 15 units each side. And you don't have to do any more. Maybe you can call the patient later, but be careful, because this one can give you a big result of volumetric, and then everybody of us had someone that came in our office with a lump after the under eyes treatment. This is another case in a Chinese girl. I work even a lot in Vietnam, so I have experience with all categories and all race. And you see how it has been the result. Even here, you can even go on a lower eyelid, making small injection, very superficial, and doing massage and spreading with your finger. This is another one. And I try to erase this one. Still, she has, of course, she has to do a blepharoplasty, but she doesn't want to do. In this case, we try to hide as much as possible the result until we can. Then this is the Hyacorp phase. I have to tell you that since this is the one that I like the most, because Hyacorp phase is a real volumetric. It really gives you the possibility to sculpt the face, to change the face, to rejuvenate the face. I really love this product. because we can work glabellar wrinkles, even for glabellar wrinkles. Now this is from this picture coming from the marketing, and it's good, but what I'm thinking that better to use fill for glabellar wrinkles. Sometimes you do Botox, you do see that there's still remaining some wrinkles, then you have to use Hyacorp fill. Hyacorp fill always in the way, not too much deep, because the risk is to you know that perfectly that there is an area that with ophthalmic vein and arteries can be closed and create problem in blindness. This is very rare. I've never seen here. I've seen it in Far East because they're more aggressive. But it's better to use, in my opinion, Hyacorp fill. Then this is like the most, because it's possible to give to enhance the cheek volume, to enhance the lower third of the mandible, to rejuvenate and to give more projection to the chin. This one is a big tool in your hand. This is a correction of a lower third, as I told you, a lower third of the face, and nasolabial folds. You see after 20 days, a very good result. This is another case. You see with a deep nasolabial folds. She did the correction of the chin somewhere else, and she came with this deformity. And really, you can reshape and you can give the volume on the lips, on all the lower third, with just one product. And this is another girl. I did for her the cheek and the chin and the nose treatment, and really. I can really sculpt all the part, the superior and the inferior part of the face. Another part, there's a lower third. Actually, the people is asking a lot for the lower third of the face. It's called the Texas or something like that, and you can use this product. Using this product, you have to use very deep, close to the bone, possibly with cannulas, because with just one opening, you can treat all the length of the lower part of the mandible. You have to inject not too much because you will have a big response. It's better to inject, let's say, starting injecting 1 ml and 1 ml each side, and maybe 0.8 on the chin. This is the average. And if you can even treat the angle of the mandible, you can even treat the superior part of the mandible, the upper branch of the mandible. In this case, I treat the cheek and chin correction. She is smiling. Of course, she was happy, but mainly you see that this area has been treated 7 days before. This was the situation. And as I was telling you, we have to use, this is just to enhance how, because I'm using the cannulas, and how I think that are more effective, especially with this product, because you can spread much better, and you can avoid doing a lot of injection that can maybe create lumps or hematoma or bruises. And you can correct facial deformities. This is a facial deformity. So every time I'm doing, you will see even today, I always point to the place where I have to work, and which part I see that, which part that I have to enhance. And this is another case, a correction of facial deformity. You see that sometimes when a patient goes to doctors that don't know exactly how is the anatomy, because it's very important, the basic anatomy of the face, they start injecting the angle of the mandible, then inject some here, there, and then the patient has and herpes because it's not herpy, so she becomes stressed. And it's possible to correct following, you know, the anatomical patterns. You have to always to think what you are doing. In your hand, there is something that can be, is not aesthetical, but is even surgical. So you can even change, and you can even correct every damage that are done with hyaluronic acid. This is even, you will see specifically in the body, because one of the most important, in my opinion, indication for body fillers is correction of liposuction mistakes. And this is a composed correction of aging with enhancing all the area. Here I use almost all the aesthetic treatments are in my hands, starting from Botox, then I use fill, then I use lips, and I mix all, but everyone with his own indication. And for rhino filler is very good and lasting a lot. Even here, it's possible to use. I use mainly Hyacorp or face if I want to really give some change, especially this area, or if I want to work specifically on the tip of the nose. I use in the past I use lips. Now that is coming fill, I'm using fill that is less thick. And always be careful about injection on the nose. Maybe you follow your courses or you know how to do it, because even for the nose I've seen a lot of problem. This is another three-dimensional augmentation with a cheek enhancement, with nose and chin, and especially you see the angle of the mandible that she changed the shape of the face. Okay. This is the first. And you see that he has a loss of projection of the mid-cheek area. So mainly what we are going to do is to enhance the volume on this area. This is the nasal pad. This is the suborbicularis fat lateral. This is here is the medial, and here is the lateral fat pad. This is the 4 compartments of fat that we have to reconnect to give more projection on the area. So what I'm going to do is to start doing on this side injection with the cannula deep to recreate the upper border of zygomatic. Then from here I will come more superficial, recreate the volume of the cheek fat pad. Then he has by constitution, because it's constitutional, this kind of neck. This kind of neck usually comes because the hyoid that is here is not too much up. So instead of being here, it's down, and create, even in young people, the so-called double chin. What we have to do for reduce this effect is just to enhance the lower border of the mandible, the angle of the mandible. We have to enhance the chin. In this case, he will have more projection upper, and this will be hidden by the projection. We don't erase completely. We just give the effects of volumization in this area. Okay, so what the kind of product I'm using actually is a face. Okay. In the box of face there is a cannula. This is the 27. To me it's too small, in my opinion, because it's even too thin. It's possible to bend. This is good for a lighter filler. You can take and you can use for other purposes, but for the volumetrical one you should use the thicker, because you have to be not bend inside the tissue. Okay, I start from here. If you feel pain, tell me, okay, is important. Okay, I'm running from from the external part from here, and then I start injecting. 0.1 to 2.5. Okay, what I'm doing, I'm spreading the product. Can I have the needle? Relax. More or less. Okay, you feel uncomfortable a little. I'm more superficial. I'm going here till let's see where is the tip of my. It's fine. So here I use 1 cc. Same I'm doing from this side. Very deep, close to the bone. I feel the border. And injecting retrograde. Then in case at the end if I have to correct little volume because always one side is different from the other or the product amount is not distributed completely equally on both sides, and then we see how is the result for the cheek. And just we use 1 and 1. The product is very soft. If I want to have a good view, I can even see him from the top, and I see that it's almost the same. Okay, here to insert the cannula, can I have the pencil? There are 2 places that are really dangerous. This is one that here there is the nerve, the submental nerve that is coming. Okay, and the other one is the vein that usually runs from here to here. So we try to put it in the middle of these two places. This is about 2 centimeters you go down, and here is we consider hypothetically that is in the middle of the mandible, the vein, and it runs from here to here. And if you see, I place little more laterally the entry point. If I put more in the middle, I can the risk is to catch the artery or the vein. The artery if I'm deep, but if I'm superficial, I for sure. Okay, here I'm in the angle of the mandible, here. I inject more in the angle of the mandible. I inject from the top, sorry. Here I'm in the border of the mandible. I feel the border of the mandible here, and I go down to the chin. Okay, now it's better. Okay. Yeah, here it's even painful because there is the ligament from there is the ligament that comes from the parotid gland and the skin. So I'm going through this one, and this is why it's a little more painful. Good. For the chin, I will use the needle simply. Okay. Up. I use it from down. Okay, I'm supporting, because with the cannula I enhanced this part, but I didn't reach the middle part. So I'm coming from here, I see the nose and projection. I need a little more from here. And that's it, finished. Okay, the temple area is very, even this is very easy because it slides on the temporalis fascia. It goes down. The only thing you be careful is about the vein and the artery that runs probably on this part. There is someone that has the ultrasound. Yeah, even the ultrasound, there is a special tool I've seen 2-3 days ago that you can feel with your mobile where is the flow of the vein, and you can even point. Okay, a pinch to elevate the skin. I'm a good place. Okay. Then for the temple area, I don't need too much product. You see, I'm in a good and a safe place. I can even not too much because it can slide. You see, I can put a little amount of product, and then consider that we are using face that will have more volumetrical response during the time. Okay, I go little and I put. Right here in the bone, you feel the upper part of the orbit lateral. This is a pretty safe area. 1 and 2, you make a rhomboid drawings. Can I have the face as well? Okay, you go perpendicular until you touch the bone. Here I'm on the bone. Then I make a bolus here. Okay, 1 and 2, finish. We have to finish to put little more projection here. And thank you. Norge is finished. You see that he has this hollow. Okay, in this case, as you see, the orbicularis is lengthening on the lateral side and is pulling down, and here appear all the fat down, and this hollow, one side and the other. Okay, what we have to do in this case, that is a case not easy, but it's little complicated. We have to fill little here, this area. Then we go do a slight infiltration on here. Because if you do infiltration only on here, it will not have a resolution of the problem, because it's down like that. And this is it's keeping from the ligamentum of the eyelids that keep the tarsum tight and orbicularis muscle. And the lateral part is sliding down with all the skin. So we will feel this part, and this area in two different ways. Here, as I told you, pointy, and here much more deeper, not too much, okay? Okay, finish. It's okay, we have connector. But in any case, okay, but the concept is to fill a small syringe. So in this way you can better control the amount. And changing the needle with a 30G. Okay, this treatment for sure can leave some bruises. You can tell the patient. You see, I'm very superficial. This is the amount of filler I'm going to inject. If I have a cream, I can even massage it. Yes. Unfortunately, this area, as you see, some little bruises can happen. More than this is not possible to do. Still little remaining. Patient standing, you see we correct, but still we have this one, and we have to inject. More than this is not possible. It's better to see the result. If you have eyes, after a treatment like that, it's better to put eyes because it will feel more relaxed and it will more comfortable for sure. Yeah, always when you do eyelid, keep in your fridge some eyes to treat. Do they have here eyes? Because if you have eyes, you see after a few minutes how it's coming very... Don't let him go out, especially if you don't put eyes, because no, it's not because it become dim, but because the result is showing immediately. Body volume augmentation in the past was only in the hands of who's a plastic surgeon. Let's say if you were a plastic surgeon until 7-8 years ago, you usually, people that come, I want to enhance the shape of my body, shape of my buttock. We had only two options, the fat and the implant, because it was not so popular, the injection of fillers, even thanks even to Hyacorp that spread this product. But okay, the fat grafting is, I don't know who is a plastic surgeon here. Anybody? No, no one. Anybody's doing fat grafting of you? No. Okay, so we are talking about something that you can even marketing for you, for your patient. You have to tell your patient that are coming why you have to do fat grafting. Fat grafting is a surgery. I like fat grafting. I'm a plastic surgeon. I love fat grafting. Whenever it's possible, I take the fat and transplant the fat, and I'm happy because the result is natural. It's the same of your body. But there is a problem on that. There is a problem because it's a surgical technique. So the people has to go in operating room. And after that, the people requires a high grade of sterility because the risk of infection, the risk of are very high. And I've seen a lot of problem with infection. This is all the pictures are coming from my from my horror pictures I have. And people are coming with inflammation. inflammation, especially because they do fat grafting in place that are not operating room. They do in ambulatory. They do in a normal office. And this is what can happen. And sometimes when happens something like that, it's very dangerous, because it's not only a small inflammation, but it's coming with the Staphylococcus aureus and requires a lot of treatment. I've seen a lot of patients even coming after liposuction, lipofilling with a very heavy inflammation. So that is a very good, but must be careful and in good hand. Then you have a resorption. You have to tell to your patient, yes, I'm going to do this. You are going to do. It's better to do fat grafting. Yes, it's good, but in any case, after fat grafting, what happened? That you have the resorption on 30-40% at least, and then you cannot do again, and then you have to do again another infiltration if you want the volume. Again, you have to come back to the filler. So why I have to do before something and then I have to go again for a filler if I want to achieve the result, achieve the volume that I require. Then there is this is a surgery. No one is you as a plastic surgeon, but I can tell you that this is let's say not difficult. I'm performing, but it requires a high learning curve. So because you have to cut the muscle and a lot of patients, in my experience, I did very happy 1, 2, 3 years. After 4 years, doctor, I'm happy, but I want to remove because it's always sitting on a pillow. So you have a good volumetrical result, good volumetrical shape, nice, but you don't have the fourth dimension that is your feeling. You feel always that something different coming from your body. It's not like a breast. Breasts become from same that you have in your body. So the breast, with the time you put in a breast implant, 99% of the patient, 99.9% of patients, they say, I don't feel anything, I feel that this is mine. For the buttock, it's not like that. And this is you have to tell to your patient when they want to ask you, when they ask you, what about the implant? And this is the horror in my file horror, and the position. A lot of surgeons, or I don't know who are, they put in a wrong way and they put too big, and the one you see, one is up, one is down, infection. So it's not really an easy thing. But we have the filler that gives instead of the two results, even like the fat, give the four-dimensional result. So the people, the girl, the woman, the man, feels that this one are them coming from their own. And this is very important because it's like the fat, same. Then the most important actually is the question that we have to ask to ourselves, which product we have to decide to choose. One question of our patient, how much this product lasts in our body. Then we have to decide in which case we can use, because it's not for everybody. The filler is not for everybody, like the surgery, like everything. Then how to treat every area. As I told you before, when we were talking before starting, face filler and body filler are totally different. Does it mean that the body filler, you cannot inject face filler in a body because first of all, you don't see any result. Second, the molecule length is not, the molecule width is not so much big to take the water and to expand. So, and have to stay and resist to enzymatical aggression. This is why it's even more difficult to make a molecule of a body filler than for the face. And this is why there are not so many in the market. In the past, there was the one of the other for the body that was retired. Macrolens, sorry. My second took by Alzheimer. Sometimes I forget. I forget the name because too many names. Macrolane has been retired from the market because what was the difference from Hyacorp and Macrolane? I use even Macrolane. The Macrolane was not so stable. Used to migrate more. And then the other problem of Macrolane, they put in a market specifically for the breast. And this has been a big mistake because for the breast, I don't think that it creates a really problem of no cancer, no inflammation, nothing. But the problem came from radiologists because they wasn't able to detect the cancer. And what is the learning about this? That is not about the product itself. It's how is accepted by the community. It's not accepted for the scientific community. I'm thinking, this is my personal thinking, that in the future it will be used even hyaluronic acid for the breast, because are growing a class of radiologists that now they see sometimes, because some doctor, even if it is out of lab, it's not possible to do, sometimes inject some. I received even some refutation of the doctor, of the radiologist, say it shows some part that looks to be injected from unknown product, but they can detect this one. In the past, sorry if I like to talk, but in the past, so you understand even how is the story. In the past, even for us that we were putting implants, we had the problem at the end of 80s and the beginning of 90s because radiologists say this is hiding the cancer. It's not true. In the future, I think that even filler can be used, but it takes time. It takes to grow a class of radiologists that are used to see this one. Then the technique of implant, of course, should be different for the body than for the face. This is what we talk about, and it's different because we should inject thinking in three-dimensional way. In three-dimensional way, we think in the face, of course, but when you have a wide area, you have to consider that you have to move in a larger space. So in the face, you have more points that you can recall. So the shape of the cheek and the chin. But here, like to be in a boat in an open sea. No, you don't have any. Sometimes you don't have any relation. You should know very well the anatomy of the body, the projection, in which part you want to inject. And for body filters, Hyacorp is indicated that the first is the buttocks, and the second is the hand, calf, and volume defects. It's possible to give volume in all flat cases, upper and side, and inner and lower. With the implant, if someone comes to you, I'm thinking about even marketing for you, you can tell that those two can be done with implants. For sure, those three is not possible to achieve with the implants. But we have to do a patient selection. Patient selections, does it mean that the patient that comes to you, I want to have big buttock, must be every treatment must be successful. You don't have to take the patient because of the money or something like that, because you should have successful result. And it's important to see the patient that shouldn't have lipoatrophy. So does it mean poor tissue cover, ptosis of lower third, and skin laxity. This is very important, not to do in this patient. And how we can do? This is an empirical way that I'm doing, as called the stretch test, and the other one is pinch test. Stretch test, you see when you see the patient, you put prone, and you see the skin. If you have the skin that is moving more, you take 3 centimeters, and you see that the skin enlarged till 5-6 centimeters, my friend, it's not possible to do anything, because everything you put on the top falls down. You don't have any support, because we need to have a support. The support is coming with a septa, is coming with the fat, is coming with the connection from the fascia to the surface. If this one has the lengthening of the septa, the hyaluronic acid is not kept inside. Then is another one is a pinch test. You can even take the buttock skin, pinch and measure with a caliper. This is pretty easy. 2 centimeters doesn't mean that you have 1 centimeter and 1 centimeter of fat, and then you can start injecting. Better not to do a big, if you have a very thin person, you better not to do everything in one time, to wait a couple of 3 weeks, 4 weeks, so a couple of months, and then go on the second set. These are the exclusion criteria. This is a liposuction because it's very aggressive. Long time ago I saw this one, and this is a neurological damage. This is another the neurological damage you see with the completely hypertrophy of the skin and the gluteal muscle, and this is a good indication for implants, let's say. And this one is a skin that has too much laxity, and so it's not possible to treat with anything. It's okay, Sule, on an indication? Okay, perfect. And how to do? Maybe you know how to do, because you are still doing, is to recreate the areas in which you want to inject. This area, let's say you have even people that has been treated with injection with phosphatidylcholine or other product, and maybe they create depression. So see how is the buttock, shape. Ask the patient more or less how she wants the buttock. Then we will see the different shape of the buttock, how to treat. Then take a picture and then clean. It's more important, one of the things that is important, this is an ambulatory treatment. It's not necessary to go in operating room, but try to be more clean as possible. To use or antiseptic, use betadine as much as you can, clean as much as you can, because in some workshop, doctors said you have to change every time the cannulas. I change, let's say, the cannula, but not every time I'm doing, to be sincere, every time I'm doing another hole, because otherwise I have to have 6-7 cannulas to use in one session. It's better to change, let's say, each side one cannula to be clean, to clean the cannula every time you make another hole with betadine, to clean the air as much as you can. I never seen inflammation, infection, to be sincere, and my patient never seen. Never seen. But, you know, I don't know how people maybe have to tell you, as I'm doing workshop, I have to be as much clean as possible. Then I don't use local general anesthesia. I don't do infiltration of the area. Why? Because if I do infiltration of the area, the risk is to spread the product. So it's not to have the product exactly in the place where I'm inserting. And usually I do without any anesthesia. But this is what I'm doing. The skin point, I mark a skin point where I will place the cannula. So the patient will not feel any pain at the time I will insert the cannula. Then, what I will do, what I'm doing, I start before I put a 19G, 18G needle, I make an opening and then I use the cannula. I insert the filler, and the patient usually doesn't feel. But if you have a very sensitive one, I can tell you that you can even use lidocaine, let's say in each area. Let's say I want to go back, okay. Let's say in one area like that. You see, this is the entry point that I'm marking, and here I'm injecting the poor lidocaine. In this area, let's say I can even insert 2 cc of lidocaine, always with the cannula, retrograde spreading and waiting. Okay, wait 4-5 minutes, and then I go injecting. The patient will feel less. Not more than 2. I will tell you that I mark, and I've seen that is 20 square centimeters area, not more than 1.5-2 ml of lidocaine. The product with lidocaine, I don't trust the product with lidocaine because they're not helpful. Lidocaine is giving even rheological problem to the product. Now a lot of companies are coming back because since the beginning I was thinking that lidocaine is not helpful when you're injecting the needle, the people feel pain. When you're injecting the filler, people doesn't feel pain. So why you have to put lidocaine? This is why it's an answer that usually doctor make me. Why is not lidocaine inside this filler? This is why, because it's not helpful. Even Dr. Klaus, the one that he created, we have a long meeting. I'm in contact with him. Even him is not trusting in lidocaine. But in any case, in this case, if a patient is very sensitive, is scared, you can do it. Then the marking. This is so the marking point, because it is important. I inject here, and from here I mark the area, and I put this one sign that for me is 1X, and for you can be a circle. Everybody has to express his own artistic sensibility, and then I try to make tunnel and cross the tunnel. It's exactly the opposite. I'm coming from the liposuction. Liposuction cross the tunnel to reduce the volume. Here I'm crossing the tunnel, and maybe here, if I have to inject more, I push more and insert more in this area. I don't make lump. Some of my friends or doctors are making lumps. I don't do it because I've seen that sometimes when you're making the lumps, the risk is to have a response around and to create something that you can feel. So really a ball that you can feel inside your buttock. That is not nice. I prefer to spread, and in case to add more in the point of exertion. We will see the technique. Then it's important to me to make a taping. It's not important, but to avoid that the product, especially the one in surface, can move down. A taping is important to keep 1-2 days. Let's say I ask the patient not to do the shower for 2 days, and that's it. But where we are injecting, mainly there are a lot of questions regarding the place where I'm injecting. We are not have to inject in the muscle. In Brazil, we went and the Brazilian doctor said, "Why we do not inject in the muscle? Is not convenient, because the muscle." First of all, injecting the muscle is more painful. Second, injecting in the muscle can create more inflammation. Third, the muscle, when it moves, then it erases more easily the product. It's better to insert in subcutaneous tissue to be more deep as possible in case you want to correct the volume. If you want to correct more some irregularities of the skin, it's better to be more superficial. And be careful, because it's important to be careful to the gluteal vessel. At the time that you are going down too much, the risk is to close the gluteal vessel and to create, especially in for veins more than arteries, because arteries, when you take an artery, you have immediately the lump and the bruises, it becomes big. But even if you inject too much here, a lump down, it can even give an occlusion, partial occlusion of the artery. It's even a risk about the vein. I saw coming from doctors, because even you, if you want to be in contact with me with your distributor, they are sending me picture when they have a problem. I see that maybe they injected too much deep, and they make an occlusion of the vein, and this one can create some thrombosis, or let's say small. I never seen big thromboembolism never seen big thromboembolism in filler, never. It's not like a black fat. For this is more safe. Then we go on more on aesthetic, and the shape. Maybe you have to detect which kind of shape you are starting from, which kind of shape wants the patient, and how it's possible to achieve a nice result. This is, say, the round shape is the one that always can try to recreate the shape of the two hip sides and the projection. This is possible to achieve with the infiltration, especially of the hip depression area. And after, more or less, I will tell you how much I use for those results, and recreating a projection in the middle area. So what I'm mainly doing is injecting this part from the inside, from the lower part here. I inject this area, then I inject the projection area. As you see, I inflate all the buttock. The amount used here is not in one time, of course. I try not to inject, not as much in one time. I try to start to inject, depends on the patient. How much money does she have? Because this is important. Usually, this is a result that you can achieve after 5-6 months, injecting 7 injections, so 70 and 70 each time. So it's about 280 each side. Yes, 280 each side.
Do you have a special reason why you inject from the medial to the lateral?
No, I'm injecting from here. As I'm thinking, it's more easy for me to reach and to recover, especially at the beginning. The patient, it will not, if it has you have a fat one or have a big buttock. For the small buttock, people is always happy if you even put 5 and 5. But as I'm working in Dubai, people likes to have big buttock, and it's not possible to achieve in one time. The maximum you can even do 10 and 10 one side for tall girls or men. 10 and 10 is the average that I don't want to exceed too much, because I want to see the response. I want to see, because we don't have any We don't have any information from the patient. We don't have information about his history, if he has a disease, if you have immunological disease. I was talking before that one of the main contraindication is immunological disease. Because if you do someone who has immunological disease very heavy, the response is always bad. Even with other filler, even with polylactic acid, even with whatever, the response is always the worst you can imagine. So it makes lumps, it can painful, it can harden. This is another one with a round shape. This is the immediate result. You see that immediately you should give the patient the idea that she did something, and the patient maybe after the treatment say, you put only 6 and 6, but I don't see. After a few days she will see, because it's biphasical. It records the water, it expands in the. It's better to do infiltration very more deep as you can, because if you do more superficial, you have inflammation of the surface, and the patient feels pain. This is another one. It's a heart-shaped, so it means that she wants to have the heart, and I injected the upper part and the medial part. This is during another workshop. Of course, there was Pitangui used to say, better to make a picture to beautiful girls that you for sure you have better results. This is one of the best results I achieved in a workshop in Portugal, and you see this immediate result. Patient happy, 100% successful. If someone come ugly and wants to, it's very hard. If you do something that is nice looking, it's better. This is a square. This is even difficult to achieve a good result, because you have to think about the shape. You have to inject more in the lateral area. You cannot inject too much. So this is one of the most difficult, but you can even give more projection to the medial part, and in this way, this is a strategy to inject always this area, so it will enhance more the projection. And this is another square shape. Always this lady was flat and square, infiltrating in this area a little more lateral. You can give a better result. I told you, everybody's make a nice picture of nice girl, amazing result. But this is the people that usually you see in your clinic, I think, more than models. This is another difficult case, inverted V shape, because it has long hip, long lateral hip, and this is the result that you can achieve when you have a situation like that, infiltrating the lateral part and always the upper part and the medial. You can give medial projection, infiltrating those two areas more, especially when you infiltrate this area and the middle part. And you can give even the upper projection and can reshape completely the buttock. This is, I was telling before, when you have a skinny girl, even 3 or 4 make the patient happy, because she doesn't have to show too much. Yes, she wants all the buttock, she wants round. So mainly we have to, thank you, we have to enhance this part. I think that it doesn't have the CE, so it's about the safety and the duration. I think duration, this one You can have even two products more. You can work on surface and the depth. You can even you have more choice. So this is one and a sticker. I want to have the shape like that, and so I will take same. Usually I measure the projection. It's very important. Yeah, the marking. Okay, then I start creating the opening. I want to reach this from this opening. This one, it's useful to have crossing here and here, and this one up to reach this area. Perfect. Put little more superficial one of MLF1. We can even mix to give more balance, because here she wants more projection, and at the time you are more superficial, you have to put the less thicker product. "14" is, in my opinion, is little big, but yeah, because sometimes you can have leaking, it come out the product. But if you remain, you don't put too much here, it's not going to leak.
You prefer 18.
I prefer 18, yeah.
Más o menos probabilidad de infección porque se cierra rápidamente el punto de entrada.
Okay. Okay, I'm deep. Okay.
El plano.
And it's very easy and soft. This is Hyacorp MLF 2. This is 2? Yeah. No, because I feel very soft because of the cannula. Going with this cannula is very soft. So because you see the pressure. Okay, this is you see here is a mistake when you go and you see the tip of the cannula. No good. Okay. This is not good. Okay. You have to pinch and go slide. And then when I'm here, you see I'm going through my edge. I draw. This is the second. With this cannula, I only need maybe to have 2 openings. This one I don't need. Because if I have the shorter one, I need even the other opening. Okay, then.
You leave the cannula inside?
Yes, I leave usually, exactly. Okay. I try to move as less as possible the cannula, because the more I move and the more the risk of infection, let's say. Okay, now we give projection here.
Number 2.
This is the third MLF2. This time I'm doing Maximum you can reach 10, but in this case, you see that she doesn't have the need of 10. As I can benefit of MLF2, as you see, I'm more superficial, you see?
En otra sesión puedes también aguantar porque se las voy a mandar 3 meses.
Yeah.
You won't spread that much.
Yeah, and I can benefit to use this one. So for her it's good because she has a very good skin. Okay. We have steri strip. This is important. Look at the end projection, and look that here it doesn't show that she has a little depression here and here. I leave this one because I'm waiting that the hyaluronic acid will slide little down. Okay, so you see this one and this one. It's not because I forgot, but I'm thinking when she's standing, this one will come little down. Okay, because you have always consider migration. Migration, it always is. Okay, for the hands, the hands is one indication that I think is one of the main indication that we have a better result. Usually you can do with the fat, with the calcium hydroxyapatite, with polylactic acid. But I think that with a macromolecular hyaluronic acid, you achieve the best result, because sometimes with the polylactic acid, with the calcium hydroxyapatite, if you don't do the right concentration, you can have even some fibrotic responses. I've seen people that it was coming with nodules on the surface, because the space in which you have to insert is very thin, and you don't have to use too much. Product. You have to use each end at least 2.5-3 ml, not too much, and it's very easy because you have to make an infiltration.
Or both of them.
Pardon?
2.5
Each. You have to do an infiltration, always this entry point. Then with the cannula, you go on inserting from the skin and the fascia, and it's very easy because you see it's quite a vascular area, so you cannot create. It's very rare to create hematomas or bruises, and you go. I always do injection retrograde, but someone is making a big lump, then it starts massaging and spreading inside. Then you can even treat those areas with a small needle. Injecting is very painful for the patient. And here there was a video. I don't know if, okay, this is a video. I don't know why it's not starting for the. So I create the space with the cannula, then I push retrograde. These are the result. This, of course, this is before and this is after. They put in different way. This is one of the results. I have several thousands of results, but the most important thing to know that it's really safe. Don't overdo the risk. A contraindication is psoriasis, hyperkeratosis, precancerosis, arthritis, and Raynaud syndrome. So ask the patient each time how she has, even if she has Raynaud syndrome, arthritis. On my patient, I've seen just a couple of cases. I did so many, especially when they are used to stay in the cold they use to stay in the cold weather, in the snow, and they don't put gloves after the treatment. They can have inflammation, or even if they use aggressive product like to wash or to clean, it's important to tell the patient not to use too much aggressive soaps when they wash the dishes, to put gloves after that. This is a precaution that I always say to my patient. Okay, so what we are doing actually is the hand. We can make one. You can make one or two entrances. Accordingly, you can even do just one entrance here in the middle. Try to avoid the vein, and that is very easy to avoid because they are showing. Can I have, please, anesthetic? Okay, for her, that she has small hands, I think 2 cc, 2.5 is more than enough. Okay. So it's very easy. Pain.
Esto no.
Vale.
Ah, dolor no.
Dolor.
No.
Come softly. We'll start injecting. I'm using MLF1. You see, I'm going to inject, and then I spread all the. Yes. Okay. And if I want to do even this area, I can put a little dot.
Needle.
No, I can do with the needle, but no. If I want, we have to do anesthetic here.
Tampoco puedes aspirar, ¿verdad?
Bolitos superficial.
Little painful this one, no. It's important to spread the product and massage. Take your 5 minutes to dedicate to this procedure, because in this way you have more result and more showing and a good effect. No lump, nothing. Okay, if you can tell her not to do to use gloves when she's going to wash the dishes, or she's going using soaps, not aggressive soaps.